Namaste everyone, my name is Pooja Vyas and I'm a registered physiotherapist here in Ontario, Canada. In today's video, I'm going to be talking about torticollis. I specialize in pediatrics and in pelvic health, and we see a lot of kids with torticollis, and it's one of the most common conditions and one of the most common diagnoses that we treat in the outpatient office. That being said, many parents do get a little bit stressed out when they hear that the newborn or their 2-year-old or 1-year-old is diagnosed with torticollis. So today what I'm going to do is I'm going to discuss a few things, just to give you a brief about what torticollis is and what all we can do in terms of physiotherapy so that you're better informed and less stressed. So let's get started. So what is torticollis? Torticollis is a congenital musculoskeletal condition wherein the muscle in the neck, the muscle is called sternocleidomastoid. This muscle either is tight or short, which leads to a head tilt, right? So if there's a shortening of the muscle right here, this is what happens, you get a head tilt. And there's also a rotatory component, that there's a rotation towards the opposite side. So when there's a head tilt towards the left side, it's called left torticollis. When there's a head tilt towards the right side, it's called right torticollis. Diagnosing torticollis. So if it's a severe or a very pronounced torticollis, then it's diagnosed either at birth or in the next few appointments. If it's a mild or a moderate case of torticollis, sometimes it's missed by the doctors and mothers would go back with complaints regarding head tilts or preference of one side, or even if you change the position, this child would still come into that left-sided or right-sided head tilt. Sometimes you'll see there's a spot, like a bald spot. If the child just keeps the head in one position, you'll see a bald spot or a change in the shape of head, and that could possibly lead to a diagnosis of torticollis. Other than that, once you get the diagnosis, once there's an established diagnosis for torticollis, physiotherapy is the first line of treatment. We get really good results with physiotherapy treatment for torticollis. So in physiotherapy, in terms of physiotherapy, we have two basic treatments. One is the active treatment and the second is the passive treatment portion of it. We usually start with the passive treatment portion of it. That is, we would be doing stretches for lengthening the muscle in the neck. We would be doing certain repositioning, meaning we would be positioning the head in a certain way that gives the head a more neutral position instead of tilting towards either sides. And we'll also be using, if as needed, helmets, torticollis helmets or tort collar. Although I don't really prefer tort collars, neither helmets, but depending on what the child needs and what your physiotherapist thinks is appropriate for the child, these are the most common passive form of treatments that we use. And then there is active treatments forms, like we would be actively engaging the child to use the full neck range of motion. We'll also be supporting the child if there is any gross motor delay, if there is any delay in the child's motor development due to torticollis, then we would be actively working on developing those skills so that the child is able to sort of strengthen the neck muscle and also keep on being developing his or her skills age appropriately. Now, if you have done your research online, you will find that there are usually, even if you get the diagnosis from the doctor, you'll get a sheet which talks to you about the stretches for torticollis. Now, there are two most common stretches that we suggest, because as I told you, in torticollis there is the head tilt. So the head is tilted towards one side. The most common stretches that you are going to stabilize the shoulder and move the head gently towards the opposite side. That's the first stretch. And the second would be, because there is also a rotation component involved, we would rotate the head towards the same side of torticollis. Okay, I'll be describing those stretches in detail, but these are the most common stretches that we give. Other than that, there's something called a football hold. We do that just, again, if the child is really fussy, then football hold is a good passive stretching technique. So we would be practicing all those. Other than that, other than these stretches, the most important thing that you as a parent need to understand is that you need to repeat those stretches. Right? You are as important and vital part of the treatment as your physiotherapist. I would say sometimes more than that. So you have to do those stretches with your child regularly. We usually suggest that the mother do the stretches, or the parents do the stretches at every diaper change. Okay, so at every diaper change, usually there's 5 or 6 times at least that you would change the diapers. So at every diaper change, you do those stretches. And then there are certain advanced stretches that your physiotherapist will also teach you once you know the child progresses. Once you take care of all these stretches, then comes the part of active engagement. You have to actively engage your child so that you sort of, get the child. So once you get that range, once you get that flexibility, you want to utilize that range that you have created so that we strengthen those muscles as well. So there are toys that you can use. You can use those, toys that make sounds so that the child is actively engaged in all directions. So let's get started with the stretches. The first stretch is the side flexion stretch. So let's assume the treatment here is done for left-sided torticollis. So left side neck bending and rotation towards the opposite side. So first we are going to treat the side bending. So because there's a side bending on this side, there's a head tilt on the left side. What we are going to stretch is we are going to place one hand on the shoulder. The other hand is going to be on the head, the whole hand, your whole palm. And then we are going to gently stretch and bring it to the opposite direction. Okay, so when you do it for the child, you can do it in lying position, like on the diaper table, or you can also do it with the child in your lap. Whatever you feel is more comfortable and whatever your physiotherapist is going to suggest to you. So you're just going to slide your hand onto the the space between your child's neck and shoulder. Stabilize the shoulder so that the shoulder doesn't come up when you're trying to move the neck, right? Because if there's tightness, the shoulder would slide up. Okay, so gentle, stabilizing the shoulder, and then using your palm, you're going to gently move the neck towards the opposite side. Okay, try to hold the stretch for at least 1 minute if you can. If not, even 30 seconds would be effective. But this has to be a slow, gentle stretch. Okay, so that's the first stretch. Whenever you're doing these stretches, try to do it for at least 3 repetitions, if possible 5 repetitions. Initially start with 3, give the child a break, engage in some other activity, and then come back for 3 more. Okay, so that's the first stretch. The second stretch, because I said we also have a rotatory component of it. So we have bending on one side and rotation towards the opposite side. This is how it would look in the child, bending on one side, and then there's some rotation to it, right? So the child is like this. So we want to gain some rotatory motion. So that's the stretch that we are going to do. So now you're going to stabilize the opposite side, the side which does not have torticollis, the right side. You're going to stabilize the shoulder here and then just gently hold on to the child and rotate towards the opposite direction. Okay, so what happens is, I'm just going to place my hand behind and show it to you. So this is what's going to happen. We are going to get some neutral head position, and then we are going to try to get the child to look towards left side, so behind the left shoulder. Basically that's what we are trying to do with this stretch. Okay, again you got to hold it for at least 1 minute, if not 30 seconds. So if there's someone who can engage the child, or if you can keep a toy on this side so that the child, because when you place your hand, sometimes it does cover their eyes as well, so they don't like it. So if there's something on this side, on the left side, to help them engage, that's a good thing. Okay, so these are the 2 stretches, the most common stretches that you are going to start with. Okay, then I spoke about the football hold. Let's say the child is really fussy and you can't really get them to sit or get them to do those stretches. So what you can do is, again, this is left side torticollis, so there's a neck bending, the head tilt towards the left side. So we are going to keep the child's neck in the nook of our elbow, just like this, right? And then we are just gently going to give a stretch. You can use the other hand to stabilize their shoulder as we used to do in the first stretch, and then you can just rock the child, move around. The child is really fussy, but you're still giving your elbow is giving the stretch. Okay, again, remember this has to be a gentle stretch. We are going to take our time with it. It does not need to be aggressive. Okay, it has to be a gentle stretch, and then you can just rock the child. This soothes the child and it's less annoying if it's if the child is not in a good mood or if they're not feeling so well. Okay, so these are the 3 stretches, and then as you progress, as the child gets more range, then your physiotherapist is going to move on to other stretches, other exercises as well.